kindly come forward for the lamp lighting ceremony. Mr. Kishore Chandra Mohapatra, sir.
I welcome you all for this 2 days workshop. This is the complete rehabilitation institute where we have got our UG and post PG courses in physiotherapy, occupational therapy, prosthetic orthotics, and also speech language pathology.
It is our honor to invite the visionary leader of our institute, our esteemed director, Dr. Patitapaban Mohanty, sir.
Deputy Director Dr. K.C. Mahapatra sir, our resource person Dr. Sushant Kumar Khilar sir, Dr. Jasya Pragya Praharaj madam, and Dr. Bhavani Prasad Ponda sir, all the participants for this 2 days workshop on various diagnostic approaches. On behalf of SVNIRTAR, I welcome all the participants for this 2 days workshop. Definitely, evaluation and diagnosis is a very important part of any medical professionals. Once you come to the diagnosis, then only you can plan the treatment program. Though the physiotherapy use more of clinical evaluation, but when it is incorporated with investigation finding, definitely the diagnosis become more accurate and the treatment can be more successful in that case.
Distinguished neurologist and extensive experience in clinical medicine and neurology. With an MD in medicine and DM in neurology, he has made significant contributions to the field of neurological sciences. May I now request Dr. Sushant Kumar Khilar to kindly take the and begin his session.
So, before discussing the nerve conduction study and its variants, you know what is electrodiagnostic studies. The electrodiagnostic studies play a key role in evaluation of and diagnosis of most of the neuromuscular disorders. And neuropathy is the most of the pathology are axonal. Few are only demyelinated neuropathy. If you are getting demyelinated neuropathy, either it is acquired or inherited. In acquired, you get some conduction block, but in inherited neuropathy, there is absence of conduction block. Or you can mark the point if you draw a straight line from the popliteal fossa to the Achilles tendon and divide into 8 equal parts. Okay. In the distal fifth, sixth division, we put the recording electrode. Okay. That is the recording of the H reflex.
A junior consultant as HCB MCH, she is actively involved in patient care and academics. I now invite Dr. Jasya Pragya Praharaj to please come forward and deliver her talk.
Activity perform at least 4 to 6 brief needle movement across different quadrants of each muscle to evaluate the insertional activity. Due to release of acetylcholine quanta across the neuromuscular junction, which will create a miniature end plate potential. The sound will be like, the potential will be low amplitude, monophagic negative potential, irregular at frequency 20 to 40 Hz and C cell sound. Here it is the C cell. When you put the C cell near your ear, there will be bombarding of the air and you will hear a sound. That sound resembles the end plate noise.
More dark. Nothing will look more dark than air. Nothing will look more dark than calcium. So this is the two end of water. One is the air, one end, another is the calcium. Bilateral, this is the most brightest. This is the basal ganglia calcification. Bilateral basal ganglia calcification. Okay. It almost, you see, it almost The bright skull bone. White things should be compared with the skull bone. Black things should be compared with the CSF. Okay. Look at the brain below. You see the inferior part of the temporal lobe. It is in posterior cerebral artery, and this is the anterior. This is the MCA.
We would now like to welcome our esteemed speakers with a bouquet.
SVNIRTAR, I welcome you for this workshop. I must thank for accepting our invitation and coming here to deliver the lecture for the participants. On behalf of SVNIRTAR, I also thank the head of the department radiology, SCV Medical College, for deputing sir and madam for this workshop. Thank you.
Good afternoon, everyone. As you all know, the X-ray is the main modality, but the ultrasound gives the pre-vital information so that it will guide for the treatment, especially the aspirations and everything.
Thank you, Dr. Prabhat, for welcoming me. I am mobilized and thankful to all the organizers of this pre-conference workshop. Myself, Dr. Sugyani Mahapatra, I am working as senior resident in the Department of Radio Diagnosis, SCV Medical College in Kotak. Today, the topic which I have been assigned to present before you, it is one of the basic topic, that is ultrasound imaging for inflammation in joints and tendon sheath. Already Dr. Prabhat has elaborated the importance of ultrasound in MSK, musculoskeletal imaging. We all know the institute here where I am standing today, it is mainly working for musculoskeletal conditions. So these two probes, linear probe, are mainly used for visualizing superficial structures. These are not useful in deep structure visualization. Then coming to the curvilinear linear probe, the surface is clearly convex outwards. This probe has a frequency of 2 to 5 megahertz in comparison to higher frequency in the linear probe. And this probe mainly used for deep structures. So in case of, you must have seen who have undergone ultrasound abdomen pelvis. Someone will focus a part beautifully and other one cannot. So a good operator with very much of experience and practice can usually diagnose a case. Okay. So to summarize my lecture, in inflammatory arthritis, you should go ahead with ultrasound to look for the 5 things.
Most important, why USG means first is cost effective, but in diagnostic imaging, what is the point to do? Like CMRI also will give you the 3D dimension, the detailed anatomy and the pathology, but why USG is very important to do in MSK? So first is no radiation exposure. The second one is we can do dynamic assessment, that is not available in CTMRI. Now so in higher centers we can do dynamic assessment, but that is every time we will do a second scanning, there is much radiation exposure to every patient. So here the USG we can do dynamic assessment. Means during the USG only we can do the contraction, relaxation of the muscle in the joint also, and we'll see the what are the effect of the tear or other pathology.
Nobody's there, but still the last concluding session. Actually, I would like to thank our directors for the organization of the pre-conferences, and also I'd like to thank our deputy directors, DDPA, for giving such a nice managing this organizing capacity, and he's helping for all the things. And lastly, I also try to congratulate or also thanks our participants who were eager to go, and also for me there are two anchors and all volunteers who has effortlessly worked for me, as well as for you also. Thanks for them. And also I thanks our video and photographers for taking for whole 2 days photograph for you peoples, and as well as our speakers. And lastly, we also thanks our speakers. Because of them, this program would not have been possible. So thank you all again for participants. You patiently here and stay for at least 50% stay up to 5 o'clock. Thank you. Thank you very much.